Chris Costa here from New Center, Maine. I just wanted to fill you guys in a little bit about a discussion I had yesterday with some doctors from Northern Light Health when they had their COVID-19 health update. And I asked them this question about two terms that we've heard a lot about over the course of the pandemic, but that haven't really changed despite everything that we've learned about the virus. And those two terms are fully vaccinated, which, as you know, is set by the US CDC. It means somebody who has finished either 2 shots of Pfizer, Moderna, or 1 shot of J&J. The other term is breakthrough case, and it's connected to fully vaccinated. That term is used when somebody who is fully vaccinated tests positive for COVID-19. And so I asked Northern Light Health leaders, should we start rethinking these terms? We now know so much more about the vaccines, the need for boosters, so on and so forth. So they had some really interesting responses, and I want to just kind of go through with you some of the information that I've found just by looking at publicly available data to kind of walk through this, because I think I'm learning more about it, and I thought maybe it would be helpful for all of you guys too. I want to make sure that's not Robin. So let's just think back to the goal of the vaccines, right? The goal of the vaccine is to prevent death and serious illness that would require somebody to go to the hospital. So how effective are the vaccines at doing that? Well, the mRNA vaccines, the Pfizer and the Moderna, the US CDC data says that in real world conditions, those 2 shots are more than 90% effective at preventing death and severe illness that leads to hospitalization. Johnson & Johnson shot, their data say it's about 89% effective against hospitalization, about 83% effective in preventing death. So what does this mean, right? They're really, really incredibly good vaccines. And we've heard this over and over again from Maine CDC Director, Dr. Shah. We've heard this from the federal level. We've heard this from local doctors at all our hospitals. We know that the vaccines are incredibly effective. Doesn't mean they're 100%. There is an opportunity for people to get a breakthrough case that allows them to have mild or moderate COVID-19. They get sick, right? They've got a fever, they've got a cough, they've got a sneeze, and they need to stay home. There is even a chance, right? With those high percentages that we talked about, there's about 10% chance that even if you're fully vaccinated, you could go to the hospital. You might die. So it doesn't mean the vaccines are perfect, but they are really, really good in preventing the 2 worst outcomes: dying from the virus and being hospitalized. Doctors in Maine are noticing a trend, though, about the people who are fully vaccinated and are ending up as breakthrough cases. Here's what Matt Marston from Northern Light Health told me.
And we have seen that for those that are more than 5 months out from vaccination, there is a clear correlation between the number of individuals that experience breakthrough cases and the time from their vaccination.
So basically what he's saying is the longer it's been since you got your last shot from the primary series, now this doesn't include boosters, the longer it's been since you got that last shot, the more likely you are, even as a fully vaccinated person, to catch COVID-19. We know that the immunity wanes over time. We don't necessarily know yet. That would be a really, really deep dive into the data about, who ends up in the hospital and who dies and so on and so forth. But basically, when Northern Light Health puts out its data that show, hey, these are all the people in our hospital, these many are vaccinated, these many are unvaccinated, they also break it down by age. And they tell us who's under the age of 60 and who's over the age of 60. Well, why is that important? If you remember about a year ago, when the Maine CDC and the US CDC started looking at guidelines for how it was going to roll out the vaccines, they looked at age as a risk factor. So they prioritized those people who were the oldest, 80, 70, 60. I think you guys probably remember this. So those people got their shots first, right? They finished their vaccines series, a year ago in some cases, or almost a year ago in some cases. Have those people gotten boosters? Maybe some. We're going to come back to that in a minute. But what we noticed in that data is that of the vaccinated people that end up in the hospital, almost all of them are over the age of 60, meaning they are older, meaning they likely got their shots first. Not all of them. I'm sure there's a 60 or 70-year-old who waited until June or July to get a shot. It's certainly possible. But generally speaking, that's what we're looking at. And so Dr. Marston told me, he said this about the effect of boosters.
And those that are boosted do have a protective effect against breakthrough illness with COVID-19.
Now that could mean mild, it could be moderate, but it also, as we know, means severe, leading to hospitalization and possibly death. So if you remember, the US CDC, it bumped up the timelines recently for when people should get a booster, right? People who got Pfizer or Moderna, they're now saying, okay, once you hit 5 months after your last shot, go get a booster. J&J, 2 months after you got that shot, go get a booster. I'm gonna need to scroll down here on my computer screen because I'm kind of looking at a whole bunch of data here. Actually, you know what? I want to show you the data. Let me show you the data. I'm going to share my screen and bear with me here a minute. Sorry, I know this part's like, all right. Let's see. We're going to share. Okay. So now let's look at the number of breakthrough cases. This is right from the Maine CDC's website. Oops, sorry. Right from the Maine CDC's website. We're scrolling down to the part that says breakthrough cases. Okay. The total number of reported vaccine breakthrough cases is 26,000 people. I will show you another tab. Shows the number of people vaccinated. How many people are vaccinated with a final dose? Right here, 968,000 people. So we're looking at, out of this number of people who have gotten a final dose, that means 1 shot of J&J or 2 shots Pfizer, Moderna, 26,000 of them have had a breakthrough case. That could be anything from just simply testing positive and not having any symptoms, all the way up to potentially hospitalization and death. And you can see those numbers right below where it says hospitalizations associated with COVID-19 associated hospitalizations among breakthrough cases, 532. 532 people who have been hospitalized out of how many people who have gotten the vaccine? 968,000. That percentage, I did the math, 0.05. So what does that mean? Of all of the people in Maine who have gotten a vaccine, who have finished their vaccine series, 1 shot of J&J or 2 shots Pfizer, Moderna, not including boosters, 0.05 percent of people who have gotten those shots have ended up in the hospital with the virus, needing treatment. That's a really small percentage. Shows how effective the vaccines are. Let's take it one step further. I know this is a little grim. I'm talking about deaths. You see right below it, 248 deaths among breakthrough cases. That's 0.02% of people who have finished their vaccine series that have died from the virus. I don't want to trivialize those 248 deaths because that's somebody's family member, that's somebody's loved one, could be their friend. It's incredibly sad. But overall speaking, that percentage is incredibly low. And one thing we don't know about the deaths and the hospitalizations is that these people may have other underlying conditions that could affect their health status and their ability to recover. Are these people overweight? Do they have respiratory issues like COPD? There are all sorts of factors that go into that we aren't told that data about the people who have died and who have been hospitalized for privacy reasons. And that's fine. But just keep in mind that we don't know that, and we don't know how many of those 248 people were also perfectly healthy, otherwise speaking. And so when I talked to Northern Light the other day, I asked them about the concept of fully vaccinated as it relates to breakthrough cases and so on and so forth. Here's what Dr. Marston said about expecting the term fully vaccinated to eventually include boosters as well.
Clinically speaking, there are some significant differences between whether somebody is boosted or not in terms of level of risk. And so I would not be surprised if the definition of fully vaccinated changes at some point in the future, and we will closely follow that as well.
And I just hope that, I think there's a lot of talk out there about how effective the vaccines are, and the breakthrough cases saying, that the vaccines aren't effective. those are just numbers, right? It's black and white numbers. There's no opinion there. It shows that the vaccines are effective in preventing hospitalization and death, incredibly effective. There's an entirely separate discussion to be had about the the percentage of people in our state who are vaccinated versus the percentage of people in our state who are not vaccinated, and why the numbers when we see a breakthrough, because we have more people who are vaccinated. If you had more people who are unvaccinated, you wouldn't see as many breakthrough cases, right? Because they haven't gotten the vaccine. That's an entirely separate discussion. We'll save it for another time. I just wanted to go through this because this is something I'm working on for today. I thought it was really interesting, and I don't want to be somebody who holds all this information to myself. I think it'd be important for you guys to know. So thank you for coming to my TED Talk. I'm sorry that it was like super dense and hopefully not too confusing. I'm going to explain more about this tonight at 5:30 with graphics that are going to help hopefully make this all make more sense. But I wanted to share it with you in this kind of, unedited way. So anyway, thanks for listening. And I hope this was helpful for somebody out there. We'll see if